Good morning, everyone. Welcome to the Eugene-Springfield NAACP Health Community webinar series on promoting self advocacy, health literacy, and patient communication. My name is Hawkins. I am the health equity specialist for Trillium and HealthNet. I am also the co-chair of our health equity and diversity and inclusion committee for Trillium and HealthNet, but I'm also the co-chair of the health committee for the NAACP. One of the things that we wanted to do here on the behalf of the NAACP is thank our sponsors here, Pacific Source, Lane Community Health Center, as well as Trillium Community Health Plan. And I also want to give a special thanks out for those that kind of heard at the beginning to the Trauma Healing Project. It is their platform, and you heard Elaine already putting in serious work for just getting this together to make sure we can send this out in Spanish as well. So thank you very much to Elaine. So this webinar is going to be six webinar series. We're doing this on Saturdays at 10 a.m. to 11:30 a.m. Just registering one time will get you all the invites to each of the sessions. So if you haven't registered, if you just use the link, please register to give you the opportunity to put in the information before. You just might want to make sure that you have the most updated link. Today's session for June 4th is about your rights to excellent health and healthcare. This is basically how to navigate the healthcare system, understanding it's pretty complex, right? And you feel like at times, I feel like at times that it's I'm fighting against the wind, right? Trying to just get basic things taken care of. So this is about how to advocate for yourself in that sense. Then there will be one about communicating with your providers, understanding, your how to self-advocate when it's with your provider, and knowing your rights and what you should say to your provider there. Selecting and working with healthcare providers is also like, trying how to choose the right provider, how to find that right fit for you is another area, how to self-advocate there. Feeling safe and valued as an individual with a patient-provider relationship. Trauma-informed care, so understanding your value as a patient and being trauma-informed about how that works within you, and making sure that's a good relationship with the provider will be another training. Managing mental health is also always a big thing, and one thing that we always want to talk about here, because that is a very important piece, and sometimes we neglect that, right? So how to advocate in that sense for yourself with the provider. Last but not least, we weren't being kind of lazy about it, but that to be determined based on earlier sessions and topics. We wanted to be able to give that last session an opportunity to dig in and go through and find out what we really needed, what we really want to focus on to make sure we hit home the tools that we needed to how to self-advocate, or the things that we really want everyone to know going forward, right? So for our webinar format here, this is going to be really kind of informal, right? This is really about the member experience, patient experience with providers, and so this entire session is there shouldn't be really providers on the call. Like, this is really a call with the members, with patients, understanding just their experience and discussing them. So we have a patient panel that'll speak first about their experiences with the healthcare system. Me, Damon Hawkins, I will introduce myself, but I forgot to mention I am the moderator as well. We have a presenter as well. Each session will have one. We'll follow the same flow with a professional addressing the topics, and then a Q&A at the end. At the end, we'll like to kind of summarize things of lessons learned from each session. The reason we're doing that is because this will lead into another training, not with the patient or with the member, but with providers, talking about how they give that space for a patient or a member to self-advocate. This is a very important discussion. This is a second training from the NAACP training committee under the health committee of the NAACP. So in that first one, by hearing these stories, we understand that our experiences, though they are there may be trends and there may be things that are similar that stand out, right? So for instance, in our additional training, we did it on anti-racism with providers, and how to build that trust-based relationship between the provider and with the patient. What we found is we started sharing stories from the health committee about experiences with racism, with providers, and found out that it was pretty common. It were similar stories, and from that, it built out a training session that providers really wanted to hear. 100 providers showed up for every session. It was 4 sessions, and 100 providers were there each time, because they also wanted to know more about how to build that trust-based relationship. So this topic is important when we talk about how to self-advocate and that health literacy. Your voice is important, and the tools here that we come up with how to address those things will show that it's not just about right now, but it's advocating. It's not just about advocating for yourself, but it ends up being advocating for others. So today's webinar, June 4th, your rights to excellent health and excellent health care. Again, the bullet points here that we'll be going over is the complexity of the healthcare system, understanding the insurance system and knowing your rights. Again, sometimes you feel like you're fighting, the insurance plan, you're fighting, the provider's office, you're fighting to get in. That's long lines in the hospital or hard to get there. And knowing what your rights are with these things and how to file grievances. What we found when we talk about people, when we talk about people of color, as our health plan, when we look through our data, it shows that people of color don't really use the grievance function or do very many appeals very often. And either it's because it might be from a lack of knowledge, like they need to know how to do it, or it might be from feeling like it doesn't work for you, or understanding the reason why. So this is a really great opportunity for for us to share this with people of color of the grievance system appeal process, because ultimately, as the story goes, the squeaky wheel gets the oil, right? So if there's no one talking about it and sharing their stories about it, then things just continue on the same way. And we don't want that to continue that way, right? So the other thing is about getting support and advocating for your care, navigators, the community health workers, understanding that your health plan has built-in things to help you navigate the system, and whether it be in your home or in the office or from different levels of things, but also the community itself. If you find that your health plan doesn't have it, the community itself actually has these things in place to help you navigate, to help you help advocate for you. And of course, at the end of this, I don't want to put our grievance and appeals staff, our manager on the spot, but I will say I had him come in here just in case, like, we get the questions that are more more than that, just more of a one-off situation. I just wanted to be able to dial a friend and have him, step in and maybe add some color to that. So again, my name is Hawkins from Trillium and HealthNet. I am your moderator. And with that said, let me introduce our panel. So first off, Isis Barone, will be one of our panelists. She was gracious to come on and will share her story. There's Susan Blivens is another person who's decided to come, who is a panel member, decided to come on and share her story. And TC Dumas, another patient or member, deciding to come in and share their story about navigating the healthcare system in our conversation today. So they, we got a chance to talk beforehand. They are a dynamic and very insightful panel, so this will be great. And of course, We have Christina Rogers from Trillium as well, the traditional healthcare worker, the traditional healthcare liaison for Trillium, and just someone that really loves people and really loves advocating. And so I couldn't think of anybody better to really share how I know how to navigate the system today. So with that said, I'm going to stop here and stop sharing my screen here and begin to start talking to the panel. So hello, panel. How you folks doing? You guys, I appreciate you again being here today. This is a great conversation. I know you guys value, what's going, the opportunity to navigate and understand the system there. So Isis, let's start off with your story here. Just tell us about, maybe a time that you've had navigating the system that we want people to know that, that it's tough, but there's a reason for being there's tools that are available to help them navigate, because you don't want these things to continue. We don't want things to continue to go on the way they were, right?
Yeah, so my name is Isis Barone. I'm a mother of 4, and I experienced what I would describe as one of the most traumatic events that anybody could occur, and unplanned and all of that. At 21, I found out I was pregnant, and my boyfriend and I both are African American, and not having experience as far as really having any issues medically, besides allergies and asthma, which I think everybody in Oregon has. I had what I thought was a pretty normal pregnancy until I didn't. I woke up one morning and I had gained about 20 pounds. And I went to the doctor and I said, something's wrong. And I was in the process of changing providers and being closer to my boyfriend's family, who was in Salem. So when I called to see about coming in, I was told by the doctor that she didn't have time that weekend to see me, and that I could wait till Monday to be seen. And this was December of 2006. It was a really bad, winter storm. And I made the drive by myself because I knew something was wrong to that afternoon appointment. And as I was walking, I could feel that something wasn't right, but I didn't understand any of the medical field, how to advocate for myself, what that looked like or what that meant at that time. So I'd never met this provider because I had just switched providers, and I walked into the clinic, which was new to me, by myself. And when I met the provider, after doing, the urine sample and so forth that you normally do each visit with pregnancy, at the time I was 32 weeks pregnant, and she walked in and she's like, "Hi, Miss Barone, you're gonna die today." And 21 years old, I'm like, what do you mean I'm gonna die today? What does that mean? And she's like, you have so much toxemia in your body that you're gonna die. And I was like, okay. She's like, unless you're willing to get care and walk to the hospital next door to the clinic. And I was like, okay. And I'm processing this. And she's like, so, it's close to Christmas, so here's a Twix bar, and threw me a Twix bar. And still processing, I'm gonna die today. Don't even know what toxemia and preeclampsia is, but apparently that's what I have. And I'm walking down this hall by myself in a full panic. And I called my family, and everyone's trying to get there safely and get there as quickly as possible. And I go into the hospital and they're like, okay, so we need to start all of these tests. And I was like, I want to have somebody here with me. I don't feel comfortable. And my sister-in-law at the time was in the area, and she came down, and she had had a baby in the past year. So she kind of stepped in as my advocate, and she's white, and she understands privilege very well. And she was like, no, this is what she said. She said this, and you need to follow this. And I had asked them to wait to do like IVs and hook me up to all of these things until somebody was there that knew, because they told me they were going to start me on a medication right away, and that I was not going to be able to see in front of me, and I wasn't going to be able to understand what was going on around me. So they did an ultrasound, and they realized that my son had stopped growing at 28 weeks. So the month that I had seen the other care provider, nothing was ever discussed with me that something was wrong or that I needed to do anything differently. So I am sitting in this hospital bed, 21, being told I'm going to die and not knowing what's going on. My family got there, and the doctor had told me that they were going to give me steroids to try to help develop the child's lungs. And then when she checked me a few hours later, she broke my water. And after she broke my water, she was like, we need to get an epidural and we need to rush you into surgery. You're having a baby. And one, I was confused. I was not understanding, and I was on magnesium sulfate. So basically I couldn't see further than my hand was blurry to me. So I couldn't see what was going on really. I was really, really sick. I had so much protein in my urine that they didn't think I was going to live. And they asked my mom and my boyfriend if they wanted them to save the baby or myself. So they're like, save her. And I'm like, save the baby. Like, I've already lived, like, save the baby. And I remember going in to get an epidural. So I am, again, by myself getting this epidural with a bunch of doctors that are rushing, and they miss wherever they needed to be with the epidural. And she's like, it's because you're moving. I was like, I'm not moving. I'm like staying still. And she's like, you did this. And so she taped the needle into my back and then tried again. And the anesthesiologist was like, no, like, she just needs to go have this baby. Like, the baby's heart rate is, becoming compromised. We need to go. So they taped that up, and then they ended up doing an emergency C-section. And they wouldn't let my boyfriend back right away, but we had a family friend that happened to work at the clinic, and I grew up with the woman's daughters. So I asked her if she would come in with me, because she was cleared to be in there because she was a midwife. So she came in with me and was able to kind of advocate for me as much as possible, because again, it wasn't her OR, it wasn't her call. So I'm in here having a baby. I passed out after I had my son, and I remember feeling the pressure of a C-section and hearing my son cry. And I was trying to tell my boyfriend, because they let him come in, I said, I can't breathe. I can't breathe. And I'm looking at him, but I can't, there's no words coming out. And I'm like, something's wrong. Like, you have to like hear me. You have to see me. Like, something's really wrong. And I'm moving my head around because the oxygen was off of my face, and nobody noticed that I wasn't getting any oxygen anymore. So I started to panic and had this baby. And now I had a baby in the NICU, and I couldn't see my baby, and I wasn't allowed to meet my baby because they thought I was going to die. So I spent a week in the hospital, and then they basically, the OB said that she wasn't going to miss her family's vacation to Disneyland for the holidays. So she induced my labor, and that I needed to be released from the hospital because it was affecting her. So she released me from the hospital, and the hospital didn't feel that that was right. So the hospital kept me on a floor that was unoccupied and had somebody checking on me while my son was in the NICU. So after multiple days of trying to get strong enough to be able to move, I was allowed to see my son for the first time. And I almost dropped him because I was so weak that I couldn't even hold him. And I was so sick, and I was in a wheelchair, and I was like, I was so disconnected with what was going on around me. I didn't fully understand. So I spent the next month in the hospital with my son. I stayed there. Like I said, they let me stay in a floor that was unoccupied. And at one point, they told me that basically that they didn't know what else to do for my son, that he seemed like he was doing great. So there was no car seat that was small enough to carry him. So they found a car bed, which is basically a shoebox. And they told me, you know, you need to take him home in this, and you guys need to go home because your insurance doesn't want to continue to pay for him to be here. And they sent us home with no monitors. They sent us home with no directions, no understanding. And they just said, you know, like, okay, well, you can do this. It's, you know, you just have to go from here. You know, your insurance doesn't want to continue to pay for this. So we went home with a 4-pound baby and no instructions, no understanding. And we're just left to figure it out. And after about a week and a half of him being home, he died in my arms of SIDS. And instead of just writing SIDS, they wrote sudden infant death while co-sleeping with mother. And when they came the morning that I found him unconscious next to me, they brought the police, and they individually asked us what we did to him to see if our stories matched up. They followed us to the hospital. They, instead of letting us ride with the ambulance, they didn't have the correct equipment to help resuscitate him in the paramedics, and he died.
Yeah, thanks for sharing, Isis, and that is I'm sorry that you had to experience that, you and your family. That's not how healthcare is supposed to work, right? And 21 years old, and even then you had some support, right, from family, and knew enough to call in support from family, but there was still room where the health plan, the health system, the healthcare system overall, biases and where the system mattered over the person. I know we're a little over on your time there, but this led to, you know, your pathway in work, right? Like you understood the importance of being able to advocate or advocating for others. Can you kind of go into that a little bit as well?
Yeah, so I became a peer support about 8 years ago, and I started working to advocate. Every one of my friends who's had a kid, I've been at the hospital to make sure things were done right, advocating for them, helping them understand that they don't have to, you know, be alone, and that's not the process that it actually is supposed to be. That you don't, you know, and even with the 3 healthy pregnancies that I did have after, I was able to have an amazing doctor who understood exactly what it was supposed to look like and advocated, and was in a place where it wasn't about the money. It wasn't about how much or who I was status or my insurance. And he told me after my son passed, he goes, I want you to know that this isn't going to happen to you again. And no matter where you are in the world, I will fly a private plane to you and get you over you losing another child. And he stuck to that with all of them. And he was like, I will literally make a way that people don't think there is a way to make for you. And this will not be your reality again. And it took that. It took being a part of people who weren't looking at it as a paycheck and were looking at it as, put the insurance aside, I'm putting this patient first because that's what's supposed to happen. And that's what I've done. I've advocated for people because if I can save one person's child through this, then that's what I would do.
Thank you. Thank you for sharing that. You know, it is our own personal lessons help us, you know, to advocate more, and also you help the provider realize that there's more ownership involved in that, right? Just by discussing that with them as well.
Mm-hmm.
And you know, we'll definitely get into more of, you know, other ways to advocate, you know, with Kristina's presentation a little later. Thank you for sharing.
Thank you. Thank you for letting me be a part of it.
TC.
Yes.
Yeah. You know, thank you again for being a part of this, and we'd love to hear you, you know, share about your interaction with the healthcare system and how to self-advocate.
Okay, my story is probably like how not for people not to advocate. In other words, as I didn't really start advocating for myself until I was almost 73, and I'm 73 now. My story, I think, is shaped by my my knowing my rights or trying to secure my rights was pretty much shaped for me throughout my life as a being an African American, being you know, at one point, and being a female very much shaped it, because like the church that I grew up in, then that was like, you know, there was no rights. So all my rights were determined and shaped by the time I was very young, and they kept getting shaped and reshaped in the way that I saw my right to anything, or my especially the healthcare system. I'm getting kind of nervous, so start over. I'll try again. So anyway, it's very much impacted my race and my age, my gender, everything, my intelligence, and everything it shaped how I was treated in the mental and physical health fields. I was diagnosed with a mental illness when I was 18. And so I've been in the system for 50 plus years. And I've experienced, you know, being African-American, I've had racism and prejudice, and discrimination. And you know, I was looked at as not, I had the experience, I had the experience of my mother who, her doctors, I believe that her death was because the doctors did not listen to her. She died at 54. And so I was determined that I would be, you know, that I would speak up and not let that happen to me. But instead I started, you know, because I wanted to have my housing, I wanted to have my finances, I wanted to have my freedom to live outside of an institution, and I wanted to have, you know, my well-being, all those things, then I had to kind of be compliant and kind of be, you know, more, you know, listening and to what I was told to do, and listening to people tell me what I was like and what I am, what diagnosis I had, and therefore living within that diagnosis, what was expected of me. And so it took me years to break out of that, thinking that they had all the answers. They knew everything about me. They knew I didn't have to live my life because they were telling me how to live it. And I didn't know how. There was something wrong with me, they told me. And so on the basis of them saying something was wrong with me, then I just thought that I need to just do what they told me to do, because they knew what, you know, they were trained and they had all these answers. So I tried to just believe what they said, even though I didn't believe a lot of the things they said, that I was misdiagnosed as schizophrenic. I was, you know, I had degenerative spine. I had heart conditions and stuff that went misdiagnosed, undiagnosed, and everything, that ended up where I was really in bad shape because of it, and hospitalized. So it took me a long time to stop listening to them. I didn't have, I would advocate for other people, and I was really much a right fighter. I didn't like other people to be abused or neglected and everything. So other people in the system, I would try to, you know, advocate for them and show them how to advocate, tell them that they were, you know, they had the right to it, and show them. And I tried to help them help themselves when I couldn't even help myself. And so I was going to tell, you know, the first time I ever filed a grievance was 7 years ago, and it did not go well. And it was the first time I ever thought of even filing a grievance for myself. I'd done things for other people, but not for myself. And so I just was not listened to. I was not heard. I was not able to call in any advocates, any witnesses or anything. And I had, you know, a mental health therapist, a case manager, a caregiver, all willing to support everything I said in the grievance complaint against the rehab facility. And they just didn't even ask for that information at all. They just pretty much just because, you know, they just did not listen, did not hear what I said. And so it didn't go anywhere.
That's man. So one, I thank you for sharing, because I do love your point of view of saying like, hey, I didn't, and even understanding that your mom early on didn't advocate for herself or wasn't heard, and you didn't later, because I found out in my own family, right? The doctor knows best, and they know better than than you do, and I've seen, and as we saw even in Isa's story, that where the provider kind of blamed the patient for the issue, and it wasn't really necessarily the patient's fault. So I've seen that, and the way that you've gone back out and advocated for others, and as Isa did as well, is showing the importance of it. The grievance piece, I do want to know, like, so who did you file the grievance with? Like, how did that process go?
I filed it. I believe it was like it was a rehab place. I had no idea what I was doing. I really didn't have help. I did talk to one legal source, and there was pretty much, I was told that, it's pretty pointless because they need the rehab centers. And so I don't know, I don't remember all the particulars. I know I was very afraid to even, put put that out, to even write anything like that, put it down in writing that I was complaining
Retaliation.
about something. Yes,
Yeah.
because it
So,
very much retaliation is real.
so on the other side of that, when you advocate for others and talk about them doing grievances, how do you go about that?
Well, what I usually do is I usually try to suggest to people things where they are. I try to see, like, I don't tell people what to do. I try to help people help themselves. I try to help them find resources, like people in the community who will help them with certain things, like, like filing a grievance or going to a doctor or finding a doctor or something like that. So I try to point them to others, and I try to also build in them the capacity that's in them already. I try to tell them, you are valuable, you are deserving, you have the right, and try to just, tell them just they're worthy because they're a person. And so just letting them see that I respect them and I believe that they should have a choice and that they are, have all the power within them that they need, that they can, have what they want, and so that I have that faith in them and that they, um, that they can do it.
Awesome. I appreciate your comments there, TC. You mentioned the other day that you actually in the community that you live in, you actually volunteer this help, the support to the senior living center there,
Mhm.
which is amazing. It's awesome. That shows your heart for the community and the people. And I'll be honest, transparent myself. Like, I'm 49 years old. I can speak of like about a dozen or even more so, just off the top of my head, instances with the healthcare system, the insurance plan for myself or for a family member, that where I should have filed a grievance myself and I haven't done it. So I, just, even in this, so the importance of it is there, and who to follow with is also important as well. Because again, change doesn't happen without it, but change also doesn't
Right.
happen without you folks, you and ISIS making that difference.
Right. And I did have other people who had lived experience, who helped me along in my journey to, being better self-advocate and being a better activist, like David Oakes and Drake Eubank. And then I also had a great trauma specialist, and I had the Trauma Healing Project who helped me to really see, see what I was, to have more, to feel like I had more, like I could be more confident and not be shot down for it.
Yeah. Yeah, and that retaliation piece is something that the good call out. That's something that people are afraid of, right? That their provider or the facility or you know whatever may do something that back to you in return, and that is actually what they shouldn't be able to do, right? They're not supposed to do. Um, Thanks for sharing that. We're going to cover some of that, and I know Christina's going to talk about some of this in her presentation as well. So I appreciate your thoughts. I told everybody beforehand that our panelists are really, really like strong people and great. Not only people that have experienced things with the health plan system, but kind of have fought back, right, and become advocates, for themselves and for others, which is, just a great thing, because we really are in this for each other, in the end. Um, so thank you, TC.
Thank you.
Susan, how are you
Hi.
doing there?
Well, that's a great question. I am sitting here thinking about how strong ISIS and TC are and how much I admire how they've managed to get through their traumas. I started out by writing down everything I wanted to say. But after listening to them, I'm thinking, that's not quite where I want to be. I have had some of the traumas, certainly not to the points that they have. Mine have tended to be milder, more slights than traumas. I do need to start with, I'm physically disabled. I use a wheelchair when I leave the house. I'm medically fragile. And the reason I write things down is I have vascular dementia. And so I may forget what I want to say. So please bear with me, everyone. Most of the time, the slights I have, the problems I have are providers ignoring me. I don't go anywhere without anyone because somebody has to push my chair. But when I have my husband or my caregiver with me, it's like I'm invisible. Providers don't ask me questions. They'll ask Lee, well, how is she feeling today? And he'll say, well, ask her, she's right there. And, I'm fortunate that I have someone advocating for me who is saying, remember, she's still a person. And you'll find that when you're physically disabled, you're not treated as a person. You're this thing in a chair. But most providers will look at you once they've been redirected and say, oh yeah, I've been talking to her for years. She knows how to talk to me. But it seems like almost every time, some people need to be reminded a person in a chair is not the chair. I have not made any kind of grievance in that case. For one thing, I want to educate. And by talking to the person, usually the nurse, not the doctor, talking to the nurse about how I am doing, what I am doing, helps at least for the moment. And I don't want to have an adversarial relationship. If I were to have a grievance, file a grievance, then I'm going to be somebody they want to avoid. And I want to avoid that on minor things. So I do need to look at some of these things. There is I'm sorry, I'm getting a little confused. And that's all right.
Yeah, no worries at all.
Yeah, but I was a mental health therapist back in the days. And one of my jobs was to advocate for my clients. I often went to appointments with them. And it was my job to try and help providers understand that just because my person had a mental illness, it did not make them incapable. And so I've always seen my part as educating, and I still do that. There was one time, though, that I really did have to file a grievance. The reason I'm disabled is I had 3 spinal surgeries. And I spent a month up at OHSU with each one, trying to recover enough to come down and back to Eugene and get rehabilitation here until I could live on my own. At one of these times, after my second surgery, I had a very, I guess you'd say, rough caregiver who was moving me from one place to the other. She pulled out 2 of the staples that was holding my spine, to the skin over my spine together. Lee'll jump in and if I'm not making things make sense. But I started leaking spinal fluid. Well, there were 4 places that said if I leaked spinal fluid, that I was to immediately go back at OHSU so that they could repair the surgical site. Well, the head nurse decided that I didn't need to go to the doctor. I didn't need to go to the hospital. I was fine. So what if I was leaking that pesky spinal fluid? After 4 days, I couldn't move without vomiting. The only thing I could see was kaleidoscope colors and shapes. The nurse still would not let me see a doctor. In fact, she threatened that if I attempted to see a doctor without her permission, she would make sure that my insurance was canceled and that I would be thrown out of the facility and I'd be on my own. Because we'd given up our apartment by that time. And Lee was living with our kids. So we'd have nothing. Well, our son came in, saw what was happening, called 911. The nurse attempted to send the ambulance away. But my family wouldn't let her. I got to the hospital, was taken, Riverbend, was taken immediately in. The doctor performed some kind of test, and all I remember is he said, "You don't have a halo." Well, gee, I'm not an angel yet, am I? But they got me up to OHU immediately. By the time I got there, my surgeon said I was within hours of dying. I was given less than a 50% chance of surviving the next surgery. And then I had less than a 50% chance, well, about a 50% chance of contracting meningitis because I'd had this hole in my spinal column. Well, if I'd contracted meningitis, I would have died. Well, as you can see, I'm still here, still kicking. But that experience is why I'm physically disabled. I can't completely use the right side of arm. I can't walk very far. There's many things that I'm not able to do, but I am alive. I was too sick to file a grievance, so Lee did. He filed because I was in a rehab facility at the time, a long-term care facility. He filed a grievance with the state ombudsman. Now that person was on her way out and she didn't do her job. She claimed she did. She claimed that she talked to everyone. We didn't even know it happened. But we didn't get any results from that grievance. Several months later, Lee checked on it because, he'd been too busy to really be involved. Found out that the ombudsman had closed my,
State had closed it.
what's that?
The state had closed it.
The state had closed it without doing anything. The only thing that happened was the nurse was reassigned. She almost killed me and she just went on to a different facility. So a grievance doesn't always work, but it is a place to start. For me, what I have found that works best is having somebody with me, having an advocate there in the hair. They can go ahead and redirect providers to me, not to the air above me, not to them, but back to me because I'm the one who knows what's going on with me. I forgot what the next thing I was going to say, so please excuse me while I look. The other thing I would say is to make sure you get as much information as possible in writing. Studies have shown that we forget at least 60% of what we're told in the doctor's office. And that's one reason you're supposed to be an advocate. But my experience is that they forget 70% of what they were told. So get everything in writing. And then if you have a question at that, get back to that doctor. Get back to whoever's providing for you and say, I don't understand, please help. Most providers I know, or maybe I'm just lucky, but most of them really want to do a good job. They want to help, but they need help. Now they've got 15 minutes to see you in, and that includes their paperwork. So it's important that you try to work together, and when that doesn't fail, the grievance usually to the provider is good. Oh, I know what else. I am the Cowlitz elder. That means that I can get my services from an Indian health service. We have a clinic here in Eugene, which I haven't had because I have good providers. But there are people who can, you can get free care there. If they don't have what you need, they can help you find it. There are advocates there. Please use the advocates wherever you are. And my time is up. Thank you.
Susan, well, first of all, thank you for sharing. Number two is I can see you like in every session that we're doing, that you just have something to bring to the table there. I love the grievance part of that, of understanding that it's it doesn't always work. And I think TC mentioned the same thing, that didn't always work. And that having an advocate is so important. And I'm glad you added a tool, a resource, like getting the information written down, right? To make sure you have it in writing is also a great to have. So I appreciate that. That nurse, your grievance for that nurse, was it? I'm asked that with CC as well. What was that with? How did you send that grievance? Was it to the state? I think you did say to the state, right?
Yes, it was to the, I went through the ombudsman, to the state nursing board, long-term care association. And what happened was, since we weren't available, she was up at the hospital at the time, that all they did was talk to the people at the facility and didn't go any further than that. And so they dropped the case because facility said, oh, nothing happened.
Right. So I just spent a month up at OHSU, but nothing happened.
Wow.
You do find that sometimes cases drop through the cracks, but other times it does work. And so you keep trying. And most people who are working as advocates or on grievances really do want to make the system better.
Yeah.
And so you keep trying.
And I do appreciate, you mentioning, that, providers seeing the chair and not seeing the person in the chair, right? So speaking over them or through them, right? That is something that, that we'll definitely take that back for the next trainings, right? Back to providers, let them reminding them of things like that, because that is important. But, Lee, being that strong support network, saying like, why are you asking me? She's right here. So, great work there.
Yeah, we've learned together, and I am fortunate that I do have Lee to advocate for me. In fact, this is how he became an advocate, is taking care of my needs.
Yeah, no, that's great. You guys are a powerhouse couple. I'm very grateful that you guys are here and being a part of this today. Um, I am going to transition just a bit. Cindy, I saw your question in the chat, and I think we are going to cover some of that. I was actually going to have maybe if Levi wanted to um, as well. And it looks like another question just come up in the chat, but I missed it. And I'm about to switch over to Christina.
I think she's going to address it. Is there time for, maybe Christina is going to speak next, and then questions can be answered by Christina and the panel, or how do you want to do questions to the panel?
Yeah, that's what I was going to do. Let Christina do a presentation there and see if some of those things get answered in that space there, and if not, we'll do a little more Q&A afterwards. So with that said, I'm going to flip this over to Christina Rogers. She is again a traditional health worker liaison for Trillium. She is a advocate of advocates. Like this is what she does, to the point where she trains people to be advocates. That's what type of person she is. I love her to death. She's authentic. And she really cares about people. I'm gonna do this, and Christina, you are up. Welcome aboard, Christina. How are you?
Good afternoon, everyone. Thank you, Demond.
How do you think of things so far, just from the panel there? Just really quick.
It's great. Even as somebody who is an advocate for others also, it's always a good reminder just to hear stories. It helps advocates, it helps our community and our healthcare system have those great reminders to kind of just remind us of what we can improve on, and how being an advocate or being somebody who serves the community, it's always a great reminder, because we don't know what's broken, or we don't know what we're doing wrong unless we hear these stories. So I want to give a big heartfelt thank you to ISIS, Susan, and TC for sharing their experience. This is a huge part of the change for our healthcare and community, because of course we're all living in the same community that has our families, friends, co-workers, and neighbors. So again, thank you. So it looks like Demond's going to present for me. So next slide, please. So I just wanted to do a little introduction. My name is Christina Rogers, and I am dual certified as a community health worker and peer support specialist. I'm currently the traditional health worker liaison at Trillium Community Health Plan. And I just wanted to share a little bit about myself. I'm the youngest of 7 children. I am half Thai and half Spanish. I grew up learning both my cultures. So if any of you have had Thai food, you know that it was quite a spicy upbringing. I have been with Trillium for 8 years. I started out in claims, then becoming boots on the ground as a community health worker, and recently becoming the traditional health worker liaison. So just a little background of where my passion stems from in becoming a community health worker is advocating for my parents. So helping them navigate the healthcare system. At a young age, I would sit in appointments with my mom to help her in understanding her recommended treatment plan. She voiced that although my mom's first language is Thai, she's been in the States for 47 years, and she speaks fluent English, and she could read English pretty well. But because of her accent, often she didn't feel like the providers were listening to her, or sometimes she would come home and say things like she felt that because of her accent, they assumed she didn't understand, and she felt like her intelligence was like they weren't, that they didn't feel she was intelligent. So I would attend appointments with her, and she had this frustration. So being part of her advocate, I would also explain to my mom how important it was also to explain that when a provider gave her these recommended treatment plans, it was very important for her to explain to him that this may go against some of her cultural beliefs or diet. And a provider doesn't know, again, unless you tell them. So at the same time, they want to learn what they're doing wrong. So we would explain this so that they could gain knowledge and understanding on how to tailor her care plan to fit our culture, and at the same time make sure that it was in the best interest, or not in the best interest, but would help her with her physical health and her lifestyle, so that we can make sure that she was receiving the best care. So next slide, please. So today I wanted to be able to share information that would support the experiences of navigating this healthcare system and ways to access care, along with support, knowing your rights that you have when facing these barriers. So I'll go over a little bit of benefits of connecting to your health plan. Who are traditional health workers? What makes traditional health workers unique? Scopes of practice of a traditional health worker, and benefits of connecting with a traditional health worker and filing a grievance and appeals. So next slide, please. Excuse me. So the benefits of connecting to your health plan. I know TC mentioned when she filed a grievance, she's used to being the advocate and advocating for others. But even as advocates, we also need to feel that support, because sometimes we get so used to being the supporter, we forget we also need to be supported. So like TC mentioned, she had a case management, and reaching out to your health plan and working with a case manager, that can mean several things. So your case manager could either be a behavioral health case manager or a physical health case manager. And they work directly with you and your families and your primary and ancillary providers to promote continuity of care and improve those health outcomes. So for instance, case managers help people understand access to quality. We all get those big books of our benefits for insurance. And honestly, who reads those? Even being in the healthcare, I have flipped through it only as I need to know, but reaching out to your health plan will help you understand those benefits. If you're not sure it's going to be covered, they could help you access resources. Also, when you've been diagnosed with the recent condition, you sit there with your doctor and he tells you have this new condition. A lot of times you're just soaking it in. I think I even heard Isis say that when the provider came to her and said that, you may die, the last thing you're thinking about is anything else they said, because, you're scared, you have this condition. So reaching out to your health plan and having a case manager, they could explain your conditions or injury and provide additional support and education around following that treatment plan and understanding that condition or injury. Often even with transitions of care, you're getting discharged from the hospital, you're not feeling well, you just want to get home in your bed, but the doctors give you this big stack of paper. A lot of times it has your prescriptions in there, but you assume when they gave you that bag of prescriptions, you had all your prescriptions. So calling a case manager or calling your health plan, they help you in understanding those discharge papers when you do get home. Make sure that you received all your medications and understand your medications. Make sure you received all your supplies, but most importantly, they ask, how are you? I think also TC mentioned that often the provider is just looking at your diagnosis and your condition. They're not looking at who you are and how you are. It's not that they don't care. It's just, being in that 1 hour window slot, sometimes there's so much going on that you don't get a chance to stop and think, how are you feeling? So connecting with your health plan, finding out if they have case management. There's several case management programs, whether it be behavioral health or physical health. They also look at the whole person. So they're not just going to connect you to those two things. They're also going to try to connect you with extra support, whether it be a traditional health worker, your oral health, your behavioral health, or addressing your social determinants of health. So next slide, please. So as I say, traditional health worker, you ask who are traditional health workers? So traditional health workers is an umbrella term for frontline public health workers who work in the community or clinical setting. So often, the 8 worker types that OHA identifies under the THW umbrella is birth doulas, community health workers, peer wellness specialists, peer support specialist, family support specialist, youth support specialist, and personal health navigator. And they also recognize tribal traditional health worker, and it's still in current development, but that will be coming soon. Good news, Susan. You'll be able to get that additional support you need when navigating your tribal benefits. It's things like when you bring up the fact that you're a tribal member, that now, you voicing that has brought, this new worker type in. Next slide, please. So all of the worker types fall under the following categories of scopes of practice. So although each worker type has experience in although they're all different worker types, they do have experience in all the following scopes of practice. So the care coordination and system navigation, working with you on connecting you to your care team and navigating the system, outreach and direct services, coaching and social support, advocacy, organizing and cultural mediation, helping you find culturally appropriate health education, and assessment, evaluation, and research. So if anybody, I also forgot to add, if anybody here today is a traditional health worker, if you don't mind putting your information in the chat, just so others could see where a lot of our traditional health workers, how they are in several settings, whether it be, often you will find them in the hospitals, schools, community-based organizations, insurance companies. A lot of them work in the state or city organizations also. So next slide, please. So what makes traditional health worker unique? So traditional health workers are unique as they do not provide clinical care. So they cannot diagnose you. They are able to provide education, and they have experience often in, how to treat under your provider's direction, but they are not a clinical team. Rather, they focus on empowering others by building trusting relationships and offering them support around healthcare and community needs. When I say those type of needs, we consider them the social determinants of health. Often you cannot take care of yourself mentally or physically if you're getting ready to have your electricity turned off, if you're living in your car and you're worried about housing, worried about getting your children to school, transportation, finances, worried about when you're going to eat next. Often you get these treatment recommendations or your care plan, and your doctor doesn't realize that, okay, yes, I need to take care of myself, but right now I don't have the food to eat with these antibiotics. So that's what a traditional health worker focuses on, is mainly addressing those social determinants of health. So next slide, please. How traditional health workers play an important role in the community is with reducing health inequities by engaging with culturally and linguistically specific community-based approaches to healthcare. They help reduce that anxiety. They help reduce those no-show rates. One thing about traditional health workers is they've been working in the communities all over the world for centuries. They apply their unique understanding, our experience in language and our culture to those they serve. So part of their uniqueness is they meet you where you're at. They meet you in your home, schools, hospitals, shelters. I know Isis described that when she went home early with her baby and needing support, this may be an opportunity for her to connect with the doula, just to have that additional support at home. And, the doula helps connect to resources, helps connect her to the care team. Why Isis gets to focus on what's important to her is her family and her child. And then even just after the loss, just having that emotional support of somebody to be there with you, to that has walked that journey with you through your pregnancy and after. Traditional health workers help build that trust with individuals' families. They support individuals in finding their voice, increase engagement and follow through. They support member in busting those barriers, including with transportation and childcare. They improve access to care and health outcomes, and they advance in the quadruple aim. So next slide, please. So I know that we've discussed filing a grievance. So this is just information about what a grievance is. Anytime you feel expression of dissatisfaction about your plan or your provider, that could include building accessibility, somebody being rude, trouble finding a provider, quality of care, something with billing or collections, who and how you could submit a grievance. Usually you or your authorized representative or even your doctor with your consent could file a grievance. And a grievance could be submitted verbally or in writing. And what happens when you submit a grievance? Your grievance is investigated to learn the facts of the situation where improvements can be made. And the health insurance grievances are responded to in writing. And again, grievances are an excellent way for you to advocate for yourself and others. And grievances are important because it's part of improvement. Next slide, please. Oh, go ahead. Yeah.
And do you mind if because we're short on time now, do you mind if we, because I saw a couple of questions in the chat, and I'm not sure, Allie, if you're the one who's going to bring up those questions from the chat, that we can kind of start discussing, or maybe talking to some of those, just so we don't miss them in the time frame that we have.
Of course, yeah, that's fine.
Thank you so much, Juan, for this presentation here, because it does show that there are resources here within the health plan that's there for them. But not only that, but also in the community. I don't want to talk, because if I talk, I'll take up the rest of the time. So, who was gonna get to the questions?
That would be me. You are correct.
Okay.
So one of one of the questions was about the process of acquiring an advocate. I'm guessing that depends on the insurance plan or not having one. So that's one question we can go for.
So as far as finding an advocate, a traditional health worker is at no charge. You can find them in a community-based organization, your insurance company. If you are with a CCO or the Oregon Health Plan, reach out to your insurance company and they can connect you with a traditional health worker. If you do not know somewhere to locate one, you could feel free to reach out to me and I could help connect you with a traditional health worker.
And I think Levi was going to respond as well.
Sure. Hi, everyone. I'm Levi Wellborn. I'm the manager of grievances and appeals at Trillium. So thank you, Christina, for your guidance on the grievance process. So I did. Question was, what is the process? Let's see. Is filing a grievance done with the healthcare provider, the healthcare facility, clinic, or doctor? So the answer is to all of that is yes. You can file a grievance directly with your doctor or the hospital. But if you don't feel comfortable with that, there's lots of other avenues which you can file a grievance. The one that I can specifically very well speak to is your insurance company. So if you file a grievance with your insurance company, that case is investigated and followed up to in writing. We may even follow up with you, with a phone call to find out more facts about the situation. We can also look at your, with your consent, we can look at your medical records and have an independent doctor look at that case and make a judgment about whether good care was provided or not. And then we take all of those grievances on not only on an individual basis, but we look at them across the board and we say, what are the trends we're seeing? So how can we make process improvements? How can we encourage that doctor, that hospital to make improvements so that your situation doesn't happen again? So it's a really important way to not only advocate for yourself, but advocate for others. So there's also, if you're not comfortable filing agreements with your insurance company, you can do it through any regulatory agency typically. So OHA, I know that the Ombuds program was brought up earlier in the talk. Any regulatory board like the dentistry board or medical board, all of those agencies have a grievance process.
Thank you. And thanks for mentioning the other options as well. And Ali, were there other questions you wanted to try to get to in this last minute? If for those that if they have to go, thank you for attending. I appreciate it. But if those that want to stay on just to hear the response to the rest of the questions, by all means, we'll be here for a little longer to answer as many questions as possible. Thank you for this first session. Sorry we ran out of time so quickly, but yeah, we'll continue to answer questions.
Just a quick comment. This is Elaine, and I put in the chat my email. If we have your email address, we will send you a copy of these slides. And if we don't, and you want us to send it to you, I put my email in the box so that you can let us know your email address, and we'll get you a copy of the slides.
Great call. Great call. Ali, were there more questions?
The only other question that I could see in the chat was about how to find culturally sensitive doctors. And for anybody still with us, our third session of this webinar series is specific to selecting and working with providers. Because that is a whole topic, right? So we're going to really dig into that one on July 16th. Awesome.
And so one of the things that I want to mention here, and just first off, thanks again, Christina, for your presentation here. Thank you for coming and sharing, and for our panelists for sharing today. And Levi, thank you for being that hotline for us if we needed it. One of the things that I really want to call out to the group today is that, the health plan, the insurance, we have the 11th best in healthcare in the world, right? And of the wealthiest countries in the world, but we're 11th of all 11. So we're last, basically, of the wealthiest countries in the world. So we don't have great healthcare as is, right? There's things that just it's more of a the way the system works is not meant for us, and is meant to be for capitalism. But still, there are things that have been interwoven in for through the healthcare, through the health plan, through the community-based organizations, you know, through through the state, that they're trying to build things in to assist with the patient. So whether it be for the care managers or for the community-based organizations with peer support specialists or youth support specialists or traditional healthcare workers, the health plans now are adopting traditional healthcare workers into their workforce because they realize how important that piece that is. And of course, the grievances and appeals, again, the squeaky wheel gets the oil. So as Levi is saying, we need the grievances that come in so we know what's going on and be able to find those strengths to address them. And just so you know, this is not just the way that Trillium does it, but this is the way pretty much every health plan does it. This is because it really is health. People that are working in healthcare really do care about healthcare. And so that means the patient matters, the patient is first, right? And this is why these pieces are put in place. I hope that the tools and resources that were brought forth out of this was helpful today. And I hope that if people need additional information or have additional questions, feel free to send them back over to us and say like, or to say like, hey, well, why not this? Or how about this? Because even that will, allows, again, this is sponsored by 2 of the CCOs in Lane County, right? So even those questions would go back to us, would be like, well, yeah, why not this? Why not that, right? And give us an opportunity to even, address those things too. Thank you to the NAACP for putting this on. Elaine, Trauma Healing Project, thank you again for being the platform that we can run this through today. I hope everyone had a good time in this session today. Also, please remember the other sessions. Actually, I didn't give shout outs to my peeps. Hold on here. I have shout outs to my peeps here. The one thing that how this got put together was from the NAACP training committee. These are the members here of the training committee. As you can see, they are from all different type of organizations within the community here, and they all are very passionate about the work for healthcare and for health equity for the community here. So I'm so proud to be able to work with such great folks in this work. And thank you guys again. I hope there is nothing on that screen there, so I'm gonna take that slide off. But thank you all again for joining us today and being a part. Please stay tuned for the next session on June 25th for how to communicate with your provider, which that will be one that is another very important one to do. Thank you very much. Hope you enjoy the rest of your Saturday, and talk to you all in a couple of weeks.